Health and Environment for March 11th, 2025, 7:30 a.m. And we will go ahead and get started with the roll call. Ms. McDonald, would you please call the roll?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Sipsey? Ms. Baggett?
Here.
Dr. Zollett?
Here.
Ms. Lawley? Mr. Bonnell?
Here.
Ms. Miller?
Here.
Okay, do we need a motion to excuse Ms. Sipsey and Ms. Lawley? Is there a motion to excuse Ms. Sipsey and Ms. Lawley?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. Ms. McDonald, the roll call, please.
Mr. Richmond?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
All right, the ayes have it. Thank you very much. Motion passes. Okay, citizen comments is next item. Do we have any guests today? I don't see any. Okay. And so we'll move on to the next item on the agenda, approval of the minutes from February of 2025. Is there a motion to approve the minutes?
So moved.
Thank you. Is there a second?
I second.
Thank you. It has been properly moved and seconded. Is there any discussion about the minutes? Good morning. All right, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yeah.
Mr. Bonnell?
Yes.
Ms. Miller? Yes.
The ayes have it, and the motion passes. Next item on the agenda is to receive and file a financial report for February of 2025. Is there a motion to approve?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Did you want to go ahead and talk about it a little bit, or?
Nope, it's in the packet. I am open to anyone that wants to learn more. We're still getting in detail, so I'm gonna make an appointment with Dr. Zollett to come in. And I'm gonna use him as the guinea pig to go through it and see, and so I'll get a little, because we really should have that individual training, but other than that, it looks pretty much, this time of year in March.
You're okay,
Yes,
Chief?
we're okay, we're okay.
I did have a question.
We always have money in March.
Yeah, I had a question about, under the revenue report, under household sewage.
Yes,
Looks like we're negative 8,734. Just curious about that.
yes, so let me look and see what you are looking at. Cause that should not, I mean, that's wrong, cause we shouldn't be at a negative in the household sewage. So, let me look and see. And maybe I'm not seeing.
Or
my
is it
packet.
down, like, 'cause it says 307%, but, oh, here it is. So, right here.
Is she on this or on the one Nancy makes?
No, she's on that one, yeah, on the revenue. And, let me pull that up, cause I can't see it. Can you see it there? It's a negative 8,000. Is that on the expense report?
That's on the revenue.
Thank you.
Okay, revenue. Okay.
Under uncollected.
Under uncollected, so does that mean we're waiting on that to come in? Because we have projected it in the budget, we're.
Oh, it's still coming in.
That's how, if it says uncollected, that's what I would think, because we have so many that we're licensing right now with permits and stuff, so it's probably funds that we've budgeted to come in. and we
Okay.
have-
That was my question, like, is that normal for March?
Okay, you have the financial report, in my packet.
I'm gonna try to make it bigger.
That's okay, that's okay, that's okay.
Yeah.
You didn't have it in yours either?
Because that was the questions, like, is that normal for household sewage? Those are licenses?
That, I'm thinking that this is probably the revenue that we receive when we've done our inspections that we do every 5 years, and so if
Oh.
that's.
Well, it's a little bit of both. There's
Yeah,
some
both
businesses,
things.
which we usually collect about $5,000 a year in addition to the licensing this
licensing.
year for the permits of the septic system.
Okay, so that will be coming in.
That's coming in now.
Nowish, okay.
Well, the $5,000 should have been, how much is collected? How much is collected at Jackie?
Yeah, it says, but you know what, that's uncollected is 8,000, so that's revenue.
Yeah.
Target percent was 12,000, but we only budgeted 4,200,
Okay, which is normally.
which is the normal, that's normal sewer, septic
Yeah.
activity.
Yeah.
And then we
Yeah.
got, for some reason, I don't know why that is, it's more than expected in
I don't know why
budget.
12 would be.
Correct.
Right.
Because
Because
of
this
the
year is the
permits.
big year.
See what I mean, right here, so it's more than, this is what we budgeted at,
Right,
4,200,
Right, and we have,
and we received,
this is the target,
yeah.
but then this is uncollected. which is interesting. Okay, so I guess you explained that, so thank you very much. I mean,
And so I'll look at that,
unless you wanna
'cause-
double check for next time,
Yeah.
just keep an eye on it.
Cause I said the target percent because we're doing the septic, cause we usually get 4,200, so we're ahead of
Mhm.
sewer, I
Mhm.
mean, the septic piece, cause we normally get every year around 4,200. But we're doing every 5 years when we do the permits. And so they're just saying that we got 8,000 more coming in. And how close are we with those receipts? Kind of,
About 100.
130 or something.
Yeah.
yeah,
Just double
okay.
check.
So,
Mm,
yeah,
wow.
so I think we're right on there. Oh, look at that, I don't like how that's reported there, though.
Yeah, it's very strange, and there's a 307.95%
Mhm.
as well on collected. So that
Your
makes
point,
sense.
your point.
What's that?
That's your
We always
point,
gonna
right?
lose with-
Yeah,
we
because
always
we
lose
always
with
get
I
that.
confused
imagine
with
it's
that
working
because.
okay, you're running the government.
Yes.
I don't-
And just a question, like, what is that? I'd like to know.
I'm gonna put a note up there for the sewage.
Okay.
I don't know, has anybody noticed increases in their water bills?
Yes.
Yes.
I'm getting a big I mean,
But you might wanna check because I checked.
I
and if
checked.
Something was.
no, I
No, it's
called,
allowed
but
to.
I mean, every month I get a higher water bill, I mean.
Didn't they put something else?
Mine was like.
I think they raised the
1%
fees
higher.
recently, and I don't, because I've heard a lot of people talk about it, and I didn't know it either.
Okay, so maybe
Yeah.
that's something to ask.
Maybe I only need one shower a week.
It
Well, but better get on that.
And I had a question about the expense report as well.
Well, I did too.
Give me the
I mean,
expense
part of
report.
it.
It's, I think, like the fourth
Yeah.
one down.
There's more than this.
And we're looking at the expense report now. It says here that on workers' comp, we're already at 100%. I was just curious about that.
Now, and we don't have anything to do with personnel, we can't do anything at the
Okay.
top with personnel, so I can check that though, I can put that down there.
Just because it's just March,
Right.
and we're already at 100%. So I didn't understand that, just want to understand it. Okay, thank you.
Plus, we don't have any workman's comp.
And yeah, so it's interesting. Okay.
Mhm.
All right.
So I'll get that too.
Thank you. Any other questions or conversations for the financial report? No, hearing that, we will proceed to vote. Ms. McDowell, please call the roll.
Mr. Richmond?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
All right, the motion passes. Thank you. The next item is our education presentation. Dr. Dunaway?
Okay, today, with all the news media about the measles outbreak lately, we're gonna talk about measles. We haven't talked about it in quite a number of years, so. Measles goes by a few different names there, but it is the morbillivirus specifically, single-stranded RNA virus, as many of them are. There is no antiviral treatment, so there's no real medication that can treat it once you contract the virus. But there's an extremely effective vaccine that's been around for quite a while. It's highly contagious. In a household, 9 of 10 close contacts are gonna get it. It is airborne, coughing and sneezing. And the symptoms start 10 to 14 days. Fairly short, 7 to 10 days. You're contagious a little bit before, and even after the rash is kind of the hallmark symptom. After the rash goes away, you're still contagious. It's typically viewed as a childhood disease, but anybody can get it. So the typical symptoms are of what we always kind of say most viral illnesses. Get a runny nose, fever, cough, eye conjunctivitis, but the rash is the hallmark. It's kind of a little light to see there, but you can see on this child's chest. Usually starts on the face, but it'll spread to the whole body. It's a flat kind of papular rash that will affect the whole body eventually. And you don't have to have that, but it's classically the diagnosis tool. Complications, of course, can come from it. It's normally self-limited. Most kids will get over it and not have a big deal, but they can develop a secondary pneumonia or even a viral pneumonia from it. They get ear infections from it, diarrhea, things that are gonna be, for the most part, symptomatically treated. In rare occasions, very rare, you get hearing loss, blindness, seizures. 1 in 100,000 will get encephalitis, which is the virus affecting the brain, and that is often fatal. So the treatment, as I said, for the most part, is just supportive. There's no true medication that's no antiviral medication that's gonna kill the virus. So you typically give them fluids, Tylenol or ibuprofen to keep the fever down, kind of help their aches and pains if they've got them. If they get a secondary bacterial infection, like a bacterial pneumonia, you can do antibiotics. But it's really just kind of getting them through the symptoms until they improve on their own. Affects about 20 million people worldwide. Currently, it's primarily a disease seen in Africa, Asia, and small portions of South America that are not as heavily vaccinated as most of the rest of the world. It's the leading cause of vaccine-preventable death worldwide. So even though mortality is low, the vaccine is so good and has been around so long, it's pretty well trusted, that it's really a preventable disease. So it's unfortunate that still a lot of kids are dying from this. So this kind of maps out with the distribution of the vaccine and improved vaccine rates, how in 1990 you had 630,000 deaths worldwide, 158,000 in 2012, down to 107,000 in 2023. Roughly the estimate worldwide is that about 85% of kids are vaccinated. In the United States, it's about 94%, and that's even with a little bit of a reduction in current years. So in the United States, you had about 3,000 cases per million in the 60s. Vaccine came out and was pushed more heavily in the 70s, dropped to 13 cases per million by the 1980s. They came out with the second dose shortly thereafter, brought it down to 1 case per million in 2000, and that's when the CDC declared the United States free of circulating measles. So the original vaccine was introduced in 1963, very effective obviously, 93% antibody response with just the first injection. It is a 2-part series. After the second injection, you get incredibly high response rates, 95 to 98%. And with that second one came the attenuated vaccine, which caused less side effects, better tolerability. And the current schedule is get it as a young child, 12 to 15 months, and then you get a booster at 4 to 6 years old. This is a good graph from the CDC that showed number of cases of measles where the vaccine was licensed, where it was implemented in the late 60s, dramatic drop in cases, and then in 1981, when the second dose was recommended, changed, and how it became almost non-existent the following years. So the big rise is the news media kind of loves to sensationalize anything that can get anybody to worry and watch their programs. But so you see a tremendous amount of news in the current outbreak. And interestingly enough, this is one of the few viruses that goes by year, calendar year, in their reporting. Most things go by season. So usually it's 24-25 season, like influenza. For some reason, I could not find a good explanation, they do measles by calendar year. So 2025, there's been 220 cases to date. That's as of January 1 to March 7th. That was the most recent update I could find. There were about 240 more cases, which I would consider related, that were in November, December of 2024. But they count that as 2024. So in 2019, you're kind of at least comparing apples to apples, because 2019 had the same concept where there were quite a number of cases in November, December, but the 2019 outbreak is really January 1. They say May 10th, but there were a couple straggler cases into June. But anyway, so far this year, there's been 220 cases in 2025, 4 essential outbreaks. The biggest one, of course, is the Texas one. As you can see, in 2019, there were 23 states involved. So far, it's still only 11 here with 13 outbreaks. So this is a much smaller outbreak than compared to 2019. 2019 was the largest, longest outbreak since '94. But the difference here is this is much more concentrated. So you have much smaller area with a more concentrated outbreak. Texas and New Mexico have accounted for 208, which seem related, have accounted for 208 of the 222 cases, and there have been 2 deaths. So even with 1,246 cases in 2019, there were no deaths. This time we have a much smaller number of cases so far, and there's already been 2 deaths, both being children who are unvaccinated. So this kind of puts in perspective the number of cases since 2000 when it was declared non-transmitting inside the United States, with how 2019 looks and 2014 looked. compared to where we are with 2024 and 2025. Again, it's something to note because it's clearly above what most years are doing, but it's well below what we've had in years past. So where are we with the vaccine? You know, we got to 95% at one point. We have dropped to 94% nationwide. Herd immunity is a moving target depending on what virus you're talking about, depending on its contagiousness, if that's the proper word. So herd immunity for measles is considered at a 92% vaccine rate, which we are still above. And most of these outbreaks that have happened over these years, including 2019, are in small pocket populations that tend not to get vaccinated. So the 1819 outbreak was the Orthodox Jewish population. There's been a Somalian and Amish outbreak. This most current one is a Mennonite population that was strong in Texas in particular. It oftentimes they are linked to somebody either coming from an area with it or someone traveling to an area with it. So again, in the United States, it's considered not spreading within the vaccinated population. Problem with the global world is people come from other places that have it, and people travel to those places and come back that have it. So they're going to areas that have measles outbreaks already, or just are inherent in those areas, and then bring it back. And then it strikes in these small populations that are not vaccinated. If you're in a bigger community of, for example, Middletown, where you have a high vaccine rate, it's not gonna create a big problem. You're gonna get the onesies, twosies, and it'll die out on its own. But you get into these smaller communities that are not well vaccinated, and that's when you get a much more significant outbreak. This is the current vaccine schedule. Kind of shows where there's been a little bit more. I put this in more because it shows where you get the 2 doses of measles vaccine, but it's also because it's kind of coming into the news again at being looked at as to what is the current vaccine schedule, and should it be spread out more, should it be adjusted? As you can see, the 12 to 15 month range can really hit quite a number of vaccines in one office visit. Years ago, we talked a little bit about this too. I mean, at that one office visit, the child can get 9 vaccines, and 2 of those actually have 3 in it. So you're looking at 13 vaccines in one office visit. And then I could find in this past week, I've not found any data about, does that improve, you know, a lot of these vaccine schedules are set up on the idea of when will we see that child again? Might not be next year for their annual wellness visit, it might be 5 years, it might be not till they're 18. So a lot of it is prefaced with, get them while you got them. Give them as many vaccines as you can on that visit while you've got that child in front of you. But I could not find any studies that looked at, is there a better way to do it? Can we spread those out? Is it best to do them all at once and be done with it? Is that lower efficacy because the body's suddenly trying to build immunity against 13 different viruses all at the same time? So I think you're gonna see that more in the news media from what I'm reading, as to should there be adjustments to the current vaccine schedule that's out there. And that's complicated by, it seems like every year there's a new vaccine. So that schedule is growing, both for adults, but this is the pediatric one obviously, but those vaccine schedules are growing almost yearly by new vaccines that are coming out.
Do you have to be vaccinated to go to school in Ohio or anything like that for certain?
The law says you are supposed to, but you can get a exemption
Yeah. And I
for
think
personal
that's what
and
it
religious
was.
reasons.
Wasn't that, I think that's where the whole push was, when we used to have the IAP grant with Irene, remember, years ago? They look at vaccine rates before too, didn't they, Chandra? I think they were looking at,
Yes.
they were looking at
For
the state,
24 months.
how, the percentage of before the age of 2. And I didn't know if that was maybe because of daycare, vaccine, illness with vaccine in children, or what. But they push that everybody's up to date, that 93, 98% of vaccine percentage, how high, before the age of 2. It wasn't like throughout the whole lifespan of a child. And so they would try to make sure their vaccines were in there. And it was probably because of daycares and getting ready to start preschool or whatever, but they were pushing it then. So, yeah, you're right. And didn't they do another MMR around 8th grade?
Mhm.
Yeah, I think so.
No, it's kindergarten, and then it's 12 to 15 months and
Yeah.
then kindergarten.
Yeah.
And that's
I thought
it.
they did,
There
I
was
thought
one
they.
at 13.
There was
They
some
did.
That's
going
the
to
tetanus.
seventh grade.
That's
Nope,
your
nope.
tetanus and
It's-
meningitis
used to
now.
have-
It
Meningitis.
used to be.
I know when I
Used
had
to
my
be in
second,
grade,
they didn't
now
push
it's
the
been
schedule.
pushed back to
What's
kindergarten.
that?
When I had my second child, they didn't push the schedule because I was leery of giving her so many shots at once, and my
Excuse me, can we please be quiet so we can
pediatrician,
hear just one conversation? Thank you, go ahead.
my pediatrician was like, no, we can do it whenever, we can wait, we don't have to adhere to this schedule, and they were really lenient with it, cause I didn't think they would be, and they were.
Mhm.
I think there is more attention being raised to that, you know, what, is it the best way to do so many all at once?
I heard something on TV, it was very interesting. They were talking and they said, well, 95% of the doctors couldn't diagnose it. 'Cause they
Measles?
said, measles, because
Yeah.
they said they've never seen a case.
Well, that's the negative that happens, of course, is,
They
you
said they
know,
wouldn't know it if they.
in the sixties, when everybody knew somebody in the neighborhood whose kid died of measles, everybody ran and got vaccinated. When you haven't seen it for years, or anybody's hardly heard of it, and doctors haven't even seen it, you know, it kind of falls out of the mind of, does my kid really need that vaccine? And so your rates do start to drop because other concerns arise, and it's a difficult situation to be in when you've controlled the disease so well that people aren't afraid of it. Or aren't worried about it, maybe is a better word.
Are there other questions or comments for the doctor? If I had a question, you'd mentioned that, it doesn't seem that dangerous, but there are secondary effects. But the two people that have died in the current outbreak have both been children. You just mentioned in the sixties, children often pass away. What causes the death?
It's the encephalitis, it's when the virus gets to the brain.
Okay, so you said that was very rare.
It is very rare.
But-
One in 100,000 cases.
But in the sixties, a lot of children were dying from encephalitis?
It was still 1 in 100,000, but it was just that there were so many more cases.
Okay.
So every season or every year, depending how it's reported, there would definitely be deaths. Whereas again, even in 2019 with 12, almost 1,300 cases,
Mhm.
there was no death. So healthcare has gotten improved as far as the supportive care. But B, it still is so rare. But back in the sixties and prior, you know, you were getting tens of thousands of cases.
Mm.
So your odds of a mortality case went up significantly
New Mexico.
in any community, not just these kind of pocket communities where most people don't necessarily know anybody.
That was another
I was-
question,
when I
because
was a
if,
kid.
if both pocket communities were, Orthodox Jewish was one, and then Mennonite was the second,
The current one.
the current one, is it just because of healthcare in general in those populations?
No, because they're all together. One would-
They're
I'm
clo- they're
curious.
close-knit communities.
I meant the encephalitis, I
Who-
meant the progression.
I think this 2 cases today, or in this current one, is, you know, for lack of a better word, a fluke, that
Okay.
you'd have 2. I don't think there's anything specific that I've read about why those 2 passed away, or versus 2019 having 0. I think it was just, you know, contracting that virus at the wrong time for those kids.
Got it, okay. Well,
And I heard that a lot of the hospitalizations with this new case is pneumonias, that the
Mm.
kids, they couldn't breathe or something. So I
Viral
think
pneumonia,
it
yeah.
probably gets in that, it probably gets with that, to those secondary things too. I think a long time ago, probably those people in the 50s probably were strong kids.
I
They
think
didn't have a
every,
whole lot
you know,
of
I can't
autoimmune things.
remember all of that, but I
Can't
think we all
remember.
got all the, I mean, we got all the things. I think I
The
must have had
vaccines?
no.
Oh, you got all the
yeah.
diseases, yeah.
You know, I think we all
That's
had
what-
measles and mumps
Yeah.
and whatever, I mean.
Oh, wow.
Chicken pox.
Yeah,
Yeah,
for
yeah.
sure.
Yeah.
They used to
All the
take
childhood
it-
illnesses.
I don't know which one it was, but they used to take it, you know, with the needle and
Smallpox.
Yeah.
whatever, I mean.
So what, you mentioned in the presentation that there's not really much to do once you have it, just try to keep the fever
Support
down.
them.
and stay
Supportive
cool.
care, yeah.
Is that it? Like, and
Yeah.
how
Yeah.
high can the fever get? Like,
High.
to go to the hospital, or what would it be around?
You know, I think, not being a pediatrician, I
Oh.
think anytime you're getting in the 104, 105, you're sending a kid to the hospital. The kids are gonna run a higher temperature than adults, and can tolerate the higher temperature, but, when they're in the 104 to 105, you're usually taking the child.
What about for adults? Would you time to go to the hospital?
102.
102?
101 is gonna be your typical true
That's
fever.
a high fever, yeah.
But if you're getting 102 in an adult, you probably need to go to the ER.
Okay, good to know, thank you. Okay, any other questions or comments for the doctor? All right, thank you very much. We will go ahead and proceed to the next item, new business. We have our no travel authorizations this month.
That's correct. Spring conference is the end of April, so we'll bring that probably to the April board meeting, but we don't have any information on it yet. But that's the only thing that's coming up on the horizon. Carla, anything environmental? Okay.
And who's going to the spring conference?
I know I will be going, and Chandra's gonna check the agenda. So it's usually, that spring conference is called the Combined Health Conference, and that's usually the sanitarians, nursing directors, and the health commissioners, and so.
Is that in Columbus?
That's in Columbus. It's at the Nationwide Conference Center.
Okay. And then, so any other questions or any comments about that? Nope. All right, move on to the second part of new business, which is the second reading of the MBHE ordinance. And so we'll just do this. Can I have a motion to read by title only, please?
So moved.
Thank you. May I have a second?
A second.
Thank you. It has been properly moved and seconded. Is there any discussion? Hearing none, we'll proceed to vote. Ms. McDonald?
Mr. Richmond?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Ms. Miller?
Yes.
All right, you just have it. Motion passes. So we'll just go ahead and read only. So it looks like MBHE ordinance number 2025-01. It says an ordinance authorizing the health commissioner to take action that may be taken by the Board of Health as licensed or pursuant to Ohio Revised Code Section 3717.29 D1 to suspend a license issued to a retail food establishment or Ohio Revised Code Section 3717.49 C1 to suspend a license issued to a food service operation. Okay, is there any discussion about that? Does anybody have any questions about the ordinance? Pretty straightforward. Okay. Then we will continue. Excuse me. Up to the second reading of the next ordinance 02. But we do need a motion to read by title only. Is there a motion?
So moved.
Thank you. Is there a second? Thank you. Has been properly moved and seconded. Is there any discussion? Hearing none, we'll proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Ms. Miller?
All right, you guys have it, the motion passes. We will read just the title for MBHE ordinance number 2025-02, an ordinance authorizing the health commissioner, any registered environmental health specialist or environmental health specialist in training employed by the Board of Health to take action that may be taken by the board as licensed or pursuant to Ohio Revised Code Section 3717.29 C1 in a retail food establishment or Ohio Revised Code Section 3717.49 B1 in a food service operation. Is there any discussion, any questions about this ordinance? Okay, hearing none, we will proceed. And the last thing is the 2025 Public Health Week, April 7th through 13th.
Every year we have Public Health Week, and it's always that first kind of full week in April. And we'll be getting information to Amy because City Council usually does a proclamation for us, and that'll be on probably that first April meeting.
I think it was April 2nd,
Is
right?
it April? Yeah, I said the first
sure.
April meeting.
Yeah. but
So
it's
it
coming
might be
soon.
April 2nd.
Yeah, it's
It might
coming
be,
soon.
yeah, that first Tuesday in April. And all the
April 1st.
information, is the first?
Yeah.
Yeah, and all the information's in your packet. That's what, we'll get that information to Amy. She does a good job with the proclamation, and we'll be there.
Does Middletown do anything for Public Health Week?
We sometimes do. We have done big events, small events. I don't know if we're doing anything this year.
I'm normally off, but I don't have it scheduled off yet. So at the very least, I was thinking we could, set up a table downstairs where most of the public
Yeah.
comes in. Or even right at the top of the second floor since it's like push for the end of tax season.
Mhm. Oh, yeah.
So people can pick up some public health information.
That's a good idea.
Mhm.
Okay, very good. All right, well, thank you. Any other discussion about Public Health Week? Okay, we will continue. Next item on the agenda are reports. The Health Commissioner report, Ms. Phillips Carter.
Yes. You had mentioned you wanted board members, maybe names somewhere. They're in two spaces on our website, with boards and commission area and on the health department page. I didn't know if you wanted it anywhere else in the information with the, on the packet or anything. You had mentioned that you wanted, so, cause
It
if
might
people were to
be-
look at the,
Yeah.
yeah, cause we have them if people are looking at our packet, like online or whatever, it's always on our board minutes.
But,
But,
yeah.
yeah. So we'll get, and then we have them in.
That works.
Yeah, and then we have it on the, health department page, and all of our, it's a picture of us at the table. And then the names are underneath the picture too, so you can kind of spot them
Oh,
out.
that's
So
nice.
just letting you know, we can get more in that if you hear any more,
I think the
desires.
Yeah, the meeting minutes works because then when we're absent also, we're still named, so
Mhm.
people can still see. Okay,
See
that
that?
works, thank you.
And for those that may not have heard yet, we have a new city manager, a permanent city manager, not an acting, is Ashley Combs, Mrs. Combs. And, most people should know that, but just in case if you're not paying attention or watching the news. Also, Middletown Connect is just busy, busy, busy. We had a good ambassador meeting where we talked about renters' rights. And we had a lot of city support there that evening. We had economic development, Alicia Moreland was there, Clayton Castle was there, communications, Larry Tuttle was there, nuisance area. Michaela was there, she was from nuisance department upstairs. And then the judge, the magistrate was there, and Steve Longworth. So we had a lot, and they were talking about some of the current concerns about housing and how city is trying to really, clean up and manage neighborhoods, and sometimes it's hard when it's renters, and they may not get a lot of support from the landlords, and so they were talking about the best way to go through that process. A lot of people wanna withhold money and not pay rent and put it in escrow. You have to do that, it's a policy or it's a procedure to do that. You just can't not pay your rent. And so they were explaining that to people and how to go through the steps, so it was a really good Q&A time to do things. When they're gonna come through and do some more cleanups in the neighborhood where they have those community cleanups. I think one may be, April 22nd, April 26th, which is Earth Day. And so, they were saying, what if we do everything we can for our house and then next door neighbors are not, or the landlords aren't? So they're trying to work between both of those together with Middletown Connect, nuisance department upstairs, and then just the community with Keep Middletown Beautiful. So they're trying to bring all these pieces together to, hopefully start making a big impact in the communities. So, more to come on that. So, and we're working hand in hand. I'll let Ms. Lawley speak about our next Walk with the Doc. But we work kind of hand in hand. We walk with the doc and then we kind of move on into the ambassador meetings. And just FYI, anybody is welcome to come to the ambassador meetings. People have requested CPR, stop the bleed training, different kind of, first aid training, anything that you want there. They did a suicide, the QPR training. So anytime the community are asking, what about this kind of training, like, what do you call it, remedial, I guess, training, we're providing that for them for anybody that wants to come by and stop by. So that's coming up this week, but this Saturday, the 15th, and
What time?
that is right after the Walk with the Doc, so it's 10 o'clock, isn't it? 10, yeah, I think it's 10 o'clock
In the same building, at the Y downtown?
at the Y downtown.
Oh, okay,
Yeah.
Mhm.
got it. In the
Yeah.
teen center room, right? On the first
Right,
floor?
in the teen center room. And Ruth, you wanna talk about the speaker at the Walk with the Doc?
Yeah, she's from UC Health and, has a personal connection with our topic, which is colorectal cancer. It's Colorectal Cancer Awareness Month, say that 5 times fast. And, so she has information about, prevention and treatment, but also her own personal story to
Mhm.
share. So, 'cause she is a survivor, so, we're excited about that. I do have, flyers, I brought flyers with me today, so,
That's good.
yeah.
And then, let's see, what else did I have? The office has been really busy. Carla's been pulling her hair out, and she can talk about that, but we're doing a lot of environmental new, software training, Acela. And it's like long, like 3-hour trainings or whatever, yeah. So it's kind of like a nightmare, but, they're doing a good job of getting all the information, cause they'll actually completely switch over June?
May.
What is it, May? And so, everything will be on this new system, so they're trying to get that done. Thank you to, Mr. Bunnell. I think we have 6 or 7 6 applications submitted, and they've been approved, so hopefully we'll get all of that in, and, I put in the packet, Amanda, and I think the lead would be Stephanie, but Stephanie and Amanda will be getting those applications together. I'm double checking them before I sign them off. So thank you, we got that done, and it was pretty easy, wasn't it? I mean, on top of the licensing, because we did all of our March licensing done too, so that is.
And more certified mail for
And,
sewage.
and more certified mail for sewage, yeah, when people were calling me, I need to speak to Ms. Carter. I'm like thinking, oh, what went out? What went out, what did I do now? Cause they stamped my name, so that's okay. Yeah, I was like thinking, Lord, just let me know when you stamp my name, I don't know, I'm so popular this week, I need to speak to Ms. So, and then with the measles, Chandra and I are trying to watch any webinars or things that's coming up, just to make sure we stay on top of that. Because if we were to get something here, it'll just be a little activity, it wouldn't be as bad, people are prepared. But, you know, it's a lot of the whole contact tracing again, right? With the schools, where were they in school? Some of the one that just came over was on the plane, and they have to look at the whole plane, the travel history and stuff. So that's when it gets kind of busy. And last but not least, last Saturday, I received an award with the YWCA, and this is the award, if you want, I just took a picture of it, because
That's
it is
nice.
probably about this big, and it weighs like probably 400 pounds. And I told Amanda, I said, don't drop it because they'll break your toe. I said, it's only what old people would say probably. But it was a nice event, got a
Wow.
proclamation from City of Hamilton, Pat Moeller, and one from Governor DeWine. So,
my
and then he
God.
sent us like a little message or whatever, so it was a fun evening. It reminded you a little bit like a baby Midfest in a sense, because it was
Ooh.
just a whole lot of cultural, like dancing and singing and different things. They had the Cunningham sisters that were, you guys remember, they were 2 little teenagers that were on The Voice from Hamilton. And so they were singing on the stage and stuff, and they had all different kind of dancers and,
Wasn't the founder of Midfest recognized?
yes, and Virginia was there in Yeah. Middletown,
Oh,
yeah,
still
she was
alive.
there.
Mhm.
Yeah, I
How
took
old is
pictures
she?
with her. I didn't ask
Seriously?
her how old.
She's gotta be old.
She up there with you?
He said she's
She's
definitely
older.
old. But, oh, that's
I'm
so
sure
cute.
she's older.
Look, stop it. He said, I'm sure she's old. Yeah, but she was there. I took a picture of, yeah, see?
Oh, look at that.
Yes.
That's
Yeah,
nice.
she was there, and it was really sweet and she's doing really well. And let me think.
Now,
What
this
else is
event,
going-
what was it called? It's called, what's it called?
It was called Her Story,
Story and Heritage.
so they say like herstory, like
And
the her
heritage?
story and heritage.
Right.
And
it's-
they put HER, what it.
And this
yeah.
is the first
Inaugural,
annual
yes.
for the rest, we're gonna have many, many more.
Hopefully many, many more. They had, it was funny, I met Mr. Goodman, and it was his, I think it was his grandmother, maybe that started a home, and like, I'm not kidding, 1900s, really, it was like, but he was the only man up there that had the banner, and he said, I have never been called a woman so many times in my life, because they were saying these amazing women, and he was standing up there in her place, but it was just talking, they were doctors and women that had started things, when they saw that, you know, women and children were needing things in the earlier years. I think they have a place in Hamilton called the Goodman Center, named after her, and they were just really interesting stories of all these different women. They had Kathy Klink that did 17 Strong, that created 17 Strong, and it was a fun weekend, very long, but very fun weekend. So
I was gonna ask you if you could speak a little bit about 17 Strong, because it
Okay.
does relate so much to community wellness and
Yes.
health and activity and things like that.
Kathy Klink started doing, I think 17 Strong came from 17 neighborhoods that Hamilton had in the Hamilton, I guess. And she started with trying to bring the communities together and help the neighbors clean up and et cetera. It's kind of like Middletown Connect.
Mhm.
It's 11 years old, and then she had been doing it for years, and then the city gave them money and gave them staff. That's what really made it kick. So that was a couple Saturdays ago. Fun event, again, they do that every year if you guys wanna come and hear the little sessions. But it's about letting the community come together with this, along with government and cities, to make your community better. And they have a little thing called the Cube. That's one of the things that are fun, the little things that's spinning off of it. So the Cube is a little, what do we call our trailer?
Trailer.
It's like a trailer. I was looking at Chandra, because we have a trailer like this. And any community can request it from the city. The city drops it off in that community, that neighborhood. And when you open it up, it has rakes, shovels, gloves, trash bags. It has anything you need in there to clean up the neighborhood. And it's there as long as you want it. And then when it's done, you put the trash and everything back in it, and they come and pick it up and restock it. And they had that at the high school on display for everybody to see what the Cube looks like. They have 2 of them. And they're just really pretty on the outside, like wrapped on the outside. So they have that if you want to do a neighborhood, like a cleanup or like a block party with cleaning up. They have micro grants where they give out money to neighborhoods that want to paint all the benches, or if they want to have a big block party and clean up, and then they want to feed people. They just have a whole lot of different things going on. They're doing some infill housing. The city is doing infill housing, and the new city manager, Craig Buchheit, said that they needed garages or something to put stuff in. So they are working with a shed company, and they have people like fire department, police department, Rotary, different people coming together to build the shed in the backyard. So it's just leveraging money, community support, or whatever to make things, better, a better place. And so it's a lot of fun. And this year's theme was, how do you make yourself a welcoming community? And so everything was based on, what does that look like to you? And so when you walked in, hello, you're welcome, that kind of stuff. So it was kind of fun. I was there because I filled in for, on a panel where a lady was gonna be gone missing because of emergency in the family, and they said, can I speak on the panel? And it was welcoming communities. And that was an interesting topic, because I told people, do not be afraid to say you don't want certain things in your community. And that meant, as you get older, you may not want a whole lot of kids outside and big wheels outside. But your community should be welcoming still if your family decided to come over that has kids, right? But you may want to live in a senior living area because you're seniors, and you might have 0 entryways and less curbs, or the curbs are real manageable or whatever. And then you might have a bigger community that has kids, welcoming for kids. So I said, just make sure that every community welcomes every generation, right? Because you have family, but it's okay to pick and so we had a good, it was a good day. We had a lot of fun. And they have a lot of volunteers and a lot of sponsors. And so that's another thing that brings the community together. Tanu Restaurant provided the food, and they had donut people that the pastries and juice and water. And so it just brings the whole community together. Pretty large event.
So like hundreds of people show. It's wonderful. If you've never been, I didn't get the email. I try to go every year. This is the 3rd year.
Yeah, it's the 3rd year.
So it is a wonderful event, and anybody can go.
Anybody can go.
And let's see, so at the last council meeting, Mrs. Carter, council member Carter, mentioned the Cube, how she's interested in it for Middletown, something like that. I think also, didn't Middletown Connect ask for funds for something like that? I heard Deanna say something about that. Do you know anything about that?
Yeah,
Years ago?
Years ago, they
2 years ago?
did a proposal to, I think it was City Manager Lolly. They
Okay.
probably still have that proposal.
Maybe they can, if that's.
Resurface again?
Yeah, because Councilmember Carter was interested, so maybe that's something that we can talk about. Okay.
A good
Thank you.
time. But what was really nice too, city employees were there. So they said they recognized all the city employees that were there. It was quite a few of them. And then I had lunch, kind of sat at the table and had lunch with 2 city council members, and was in a session with another city council member. So I think it might have been 4 of them that were there that was involved in the whole day too, so it was kind of nice. And then the chamber president, so it's pretty well attended by city officials and stuff, so it's really cohesive. I like that too.
Thank you very much.
And I think that is it. Yep.
Alrighty, thank you so much. We'll move on to our medical director, Dr. Genoway.
We have our reportable communicable disease report. There were 18 chlamydia, 7 gonorrhea, 7 hepatitis C, 2 CPO, 2 syphilis, 1 strep pneumonia, 1 pertussis, 1 invasive group A strep, 1 Campylobacter, and 1 Candida auris. That's all in my report.
All right, thank you. Any questions for the doctor? Comments? Thank you, doctor. Okay, we'll go on to our Director of Nursing, Ms. Corbin.
So the report that Dr. Genowine just read off was, not in your packet. It, unfortunately, you know, IT issues happen even at the state level. The system that we do all of our disease reporting in is having issues with what they call their queries, part of the system, and that I believe is where our EPI at Butler County pulls all of the data from to compile the report that he gives to us. It's coming back with errors, so he wasn't able to do that report, so I went through and pulled each individual disease, and so that's why, and I gave it to Amanda yesterday, so that's why it's not in your packet, so I apologize for that. The task that was given to me by Jackie this year was to work on getting a health fair set up here in Middletown. And Ms. Lally and I have been meeting with a small core group monthly now. We'll be having a meeting again next month. And we have a date. It's set for August 2nd. It's a Saturday. And there will be more to come from that, but if anybody has any excuse me, ideas on vendors or excuse me, discussion topics or anything, we are open to suggestions. One of the things that we asked our partners with Middletown Connect was to do kind of a quick survey of their folks, their ambassadors, to say, what do you want to see at this health fair? So hopefully they'll have come back with some good suggestions for us to start pulling in some more people. We're hoping to have like discussion sessions, not just a bunch of tables for people to grab stuff at. We're hoping to have like some short learning sessions. We've got the vaccination van coming from Butler County, things like that. We are going to have a Stop the Bleed training is going to also be available. So it's going to be, I think it's going to be a good thing. It's not going to be just a walkthrough kind of place.
You know, it would be a good idea to have a talk with the doc that day.
Mm-hmm.
It would
You know,
be.
and if we
Well,
can get
and-
our docs here,
Well, and
Yeah.
that
or
was
some
part
other
of the-
doctors.
That was
It's
part of
not
the
a doc
idea of
anymore.
getting the ambassador feedback,
What's Dr.
is
Mhm.
like, what do
What?
people wanna learn about? What do they
Right.
have questions about? And then we'll formulate our speakers
Yeah.
around that.
That would be so cool, wouldn't it? Because that gives you an opportunity, bring your questions that day.
Yeah.
That could be just small little things like, you know, just the tweaking them. Like, for instance, I went to the eye doctor and I said, why eye drops at night?
Mm-hmm.
I said, why? Is it because my eyes are closed all night and it gets in there better? Or is it because it interacts with, you know, maybe the medicine or whatever? So, I mean, sometimes those little tweaks might be.
Yeah.
And last but not least, Angie Smith is working with them as well, and that's over at the event center, main event center.
Yes.
Oh, nice.
Yeah, because Angie kind of wanted to do something, and then Ruth had brought up the idea of having a health fair, and then Paul Horn, our other council person, said a health fair, so I said, Chandra, we gotta just come up and put this all together, cause we can't all be doing a health fair type thing, so they're working really well together over there, because they'll be at the main event center.
Nice, and will part of it be outside if it's nice out?
That's
I
the
think so.
hope,
That's the hope.
that's the hope. I
Yeah.
mean, I have ideas, and obviously the immunization van will be outside. And with it being in August, that gives yet another opportunity for that back-to-school vaccination push, where a lot of kids are, you know, pushing it to get back into school with their vaccines up to date.
Amanda said we're gonna need 3 vans.
Oh,
It's back to school vaccination.
Those ladies they're good at what they do. They can push them through pretty
They
quick.
do a lot.
But we also have a resource now, with UC residents,
Cool.
for the, potential speakings. So, yeah, there's a lot of good things coming, getting excited, but yes, we're
Yeah,
definitely open to
To
suggestions.
build on that, I actually, had a meeting with the physician who runs the residency program at Westchester Hospital for UC. And he has a big push to get his residents out in the community interacting with folks. So he's like, tell me what you need and I will make them.
I have an idea.
Make it happen.
What's that?
Well, cause I'm so glad you said that, because, I was wondering about, like, for the kids, a couple things, are we gonna have, like, games, and activities for them, and, like, bouncy castles and stuff, but at field day last year, I can't remember what school, but, actually several different schools, they had students from Butler Tech coming in and doing little games, and one of the games was like, gosh, how'd they do it? The kids would put on a doctor's coat. Little kids, it was so cute. And they would all be the doctor, and they would carry like the patient in a blanket to a place.
Oh, like as a team?
Yes,
Like-
as a team,
Aw.
and then they'd have to like, there's a cut right here, so we have to do this and that, and we have to treat it, and then have to run back. It was a race.
So did they come up with the activity?
The
Like,
Butler
did they-
Tech students did.
We
Oh,
can
well,
ask
then that
them.
is something
Yeah.
to-
Yeah.
I actually have them on my list.
They were
um,
fantastic.
About,
Yeah, that's
you know,
a great
contacting
idea.
Butler Tech, also for career opportunity,
Mhm.
kinds of things.
That's a great idea.
Because this is you know, we kind of have a working title, thanks to Deanna, because she's so creative. It's, what the health. What the health and
What the
wellness
hell?
and resource fair. It's just,
I like it.
yeah, she said it, and we're like, that's
Yeah,
it.
that's it.
But it's gonna be a resource fair too, so it's not all going to be health related. We want people to be able to get those resources for, you know, family wellness, not
Yeah,
just
as we know,
child. and-
financial security
Yeah.
affects your
Yeah.
mental and
Mhm.
physical
You know,
health.
planning, you know, senior planning and things like
Yeah.
that. So we're trying to go full gamut, age-wise,
I love that.
and needs, so.
Yeah.
It's, you know, more to come. It's gonna be a good
They
thing.
have a residency program at that hospital?
For 2 years now.
Yeah, it's their third year residence that they're pushing out into the community.
And wouldn't it be
Yeah.
nice to get the residents working with Butler Tech kids?
Mhm.
And doing the games?
Mhm.
Yeah.
Yeah.
Yeah, it's all about that connection. That's
That's
cool.
great.
That's cool.
That sounds like fun. So you said that Councilmember Horn is also very interested in this?
Yeah, no, he was the one around the same time Ruth was remember Ruth went to a health fair in Springfield, right, Ruth? And then, Councilman Horn came up and said, it's a big health fair in Cincinnati where all the streets are blocked off and we have P&G and all. And like, yeah, we don't have all. But I said, yeah, and he said, we could do it over at the center. And so
Oh,
it was
okay.
like all coming together. And
Nice.
then I was sitting in senior staff when Angie Smith said she wanted to do something like a health fair for the seniors over there. And I said, we have to just pull this all together because we can't have that.
The vendors could all be like fruit trucks and veggie things
Yeah.
and stuff like that. I'm just saying, I love it.
Yeah,
Just saying.
when the, farmers markets start back up, I'm gonna be toddling
Yeah.
tent to tent to ask them if they would be interested in setting up an extra day. I know they have busy schedules, not only in Middletown, but, you know, wherever else they may set up. But we wanna give them that opportunity to see if they wanna set up set up a booth.
Yeah, have you talked to Jerry Lewis about that as well?
I have reached out to Jerry.
Okay, great, wonderful. All right, thanks.
Last but not least, Wick does a really good job at doing salsas with all the
Yeah.
fruit.
Who?
Wick,
Wick, the
the
they're
nutrition
one of the
piece,
partners.
the
yeah.
nutrition piece, yeah, cause they'll cut up all the tomatoes and everything, and
Yeah.
they'll have salsa cups.
We were talking about that
Yeah, we
last time
talked about
too,
doing
about
that
having
too.
like little
Mhm.
sample tables.
That could be
um,
demonstration.
Like,
Mhm.
mocktail table.
Mhm.
So all those kinds of things have been kinda getting thrown around.
Yeah.
So, yeah.
When are your meetings, are they open?
I was gonna say, you wanna come?
Yes, could I?
Yeah.
Yeah, we'll get you the information.
Yeah.
I think
We
that'd be
meet
great.
again this
Yeah.
month.
Just to
Okay.
be at-
So
I think
third
it's next
Wed,
week.
is the third Wednesdays at 9:00 at the event center?
Sure.
I'd love to learn more, yeah.
And last
Yeah,
but
the
not least,
19th.
the 19th?
At 9:30.
I'll be able to come
9:30.
probably, hopefully in April then.
Okay.
Okay, yeah.
And Joe, with you, are you involved with workplace health plans? Isn't that what you actually do? Yeah, that's what you actually do, right? Because maybe we can have you involved with some of this too, of how to get more people involved in workplace health plans, the importance of it or whatever. Because we have a big one here at the city. It's just not, it's always been a struggle to get people involved, and they give you free stuff or whatever, but It's just something about people always thinking they'll know my blood pressure, or they'll know what I.
They only know what to put in it.
Yeah, and so anyway, you know, though, maybe the barrier's there and that would be nice, to try to get the whole kind of board kind of involved with that, because I would love, that's a place that you can tap into and really get good benefits from your workplace, health plans, and people don't really take a good advantage of that for some reason. I told you, I think it's every time we talk to people, they'll know my blood pressure.
Yeah.
And their insurance will go up, yeah.
They'll know my blood pressure, yeah, they're afraid that
That's a
you'll know their
deterrent.
health information, yeah.
Yeah.
We can tell when people have bad blood pressure. I'm telling you, health professionals can kind of tell, they can look at you, you got blood pressure. I'm just teasing, okay, so that's it.
All
I was
right,
gonna say, I
so-
only have one other thing, and that's the FEP grant. We're just finishing up the third quarter of our FEP grant for this 24-25 year. Just submitted our after-action plan, improvement plan, yesterday for our tabletop exercise. And then I have a couple more, there's an administrative plan and a modification to our point of distribution plan that need to be done. And then hopefully, next meeting, I may have the upcoming contract for you guys to review.
Okay.
You know, if things move the way the state normally moves, it may not be until June. But I'm hopeful that it'll be next week.
All right.
And that has to go through law department
Law
as well,
first,
yeah,
yeah.
and so that's another.
All right, any questions or comments for Ms. Corbett? All right, we'll continue with our environmental health director.
Okay, for the month of February, we received, one set of plans for a mobile. We approved one retail food establishment and a micro market, and licensed, one retail food establishment. Let's see, we have about 130 sewage, applications and payments to come in for the septic systems. That's the fire for your septics. It's a 30-day notice. If they don't pay within 30 days, they'll be applied to their taxes. So we have those coming in. And continually accepting our license renewals for our food program. Those are due March 1st. So we have about 20 applications that are out, and we're continually calling. Well, we call them to come in and pay. So hopefully we'll get those this week. As Jackie, in the packet, we did receive the Water Pollution Control Fund grant. It's a $150,000 grant, and this grant will be used for the septic system, failing septic systems within the city. The homeowners have to apply, and it's income-based for the grant. So we're looking forward to that. Currently, we have to come up with the resolution and a contract. The contract will be between the health department, the board, and the businesses who will install the septic system. So EPA has to approve the contract and the resolution. So currently, it is in the hands of law to create the contract. Not create the contract, they have to put the contract together and the resolution. So hopefully we'll have that for the board, the next meeting. That has to be submitted to EPA by April 30th. And our next meeting is
April 8th.
April 8th, so hopefully we'll have time for that.
So they have septic systems in Middletown?
Mhm.
Most of them are where, Amanda, is that what you
Yes,
said?
there's probably about, did we say 400 in Amanda area? Yeah. We
Then
have a
they're on
total-
Cincinnati Dayton Road,
Yeah.
and then they're off Lefferson.
We have a total of like 700 systems in the
Wow.
city, yeah. But I think yeah, like I said, it's income-based. They can receive up to 100%, 85%, or 50% of whatever the system is based on their income. And they go by the poverty
Poverty
guidelines.
guidelines.
I can get that word.
I was gonna say, and just to add, we were with the mayor yesterday speaking about the whole process of this, right? So it is one contingent on getting the money. The money is not supposed to be available until July. So we can't start doing anything until July, 1. 2, the work has to be done first, and then we have to submit the invoice to the program.
What's
So,
the work? What are you doing?
like if a person needed a repair on their septic, and it was $8,000, and then we have to get all that together, and then get the invoice for that $8,000, then submit
And
it.
the state pays for
And the
first
state
and-
reimburses us.
I got you.
So we'll have to have the city appropriate money in a line item for this, right? Because we don't have any money in our budget because this is mid-year. It takes, and the grant goes all the way until 2026, so that we can be doing the work. And then, we said 150,000, sounds like a lot, but if you have to replace a system, it may be more. So we just go until the money runs out. And then it's also, you could take a certain percentage, like 3% of administration fee. And that's that work from the contract or whatever. So it's dependent upon if the money comes down in July, because EPA is a federal grant, and so we don't assume anything. And then we start working, and people will think, oh, it's as easy as applying, but no, you have to be approved, you have to go through the whole contract. You have to be homeowner, so the landlord can apply for it. No, he can't, because I was gonna say, he owns the home, but it has to be right, owner occupied, yeah.
Okay.
And then you have to file, and then you have to be on a income guideline thing.
And
So it's some little criterias in there, but again, we, hope this is a piece of helping the community, right? Because it's better, we've talked to some of the residents in that area, and it's better to get a little bit of help.
Is it cost prohibitive to go to, I guess, to put in plumbing or whatever, right?
It's not available.
Oh, it's not
There's no
even-
sewers to tap
Sewer.
into.
Not even,
There's no sewers to tap into, so you have to repair, and you have to repair or replace, right? That's the statement, you have to repair or replace, if you're having a failing
yeah,
system.
gotcha.
Now, there may be some other areas in the city where, they could
Mhm.
connect, cause the grant allows you to connect to sewers too, but you still have to be, it's based on your income, so.
Mhm. And that's what we call the tap in, right? The tap it into a sewer, yeah.
And also, septic systems, just to be, the grant, it sounds like a lot, but it's, when you look at it, it costs $30,000 for a septic system, $15, $20, $30 to $30,000. It's not, yeah, it's not a whole lot. I think Jackie mentioned about Acela, which is the new platform, database that we will be using starting in May. We are currently using just a health space. And the reason why we're going to Acela is because the state is funding it. If we were to stay with health space, it costs about $40,000 at minimum to stay with that. Of course, we don't have those funds. So, the platform will be used for all of our programs, so that's nice because we still use, HDIS also for our sewage, so everything will move over to the new Acela, program, and it's a public-facing program, which is nice. They're really trying to get, so we don't have to do so much in our office work. The, businesses can apply, submit plans, and do all of that on their end, without having to come in the office and even pay for the license, which now they usually have to come in or put it in the mail. So we're looking forward, to that program. It's a lot of training. We spent 3 hours on a training yesterday, and these are pre-recorded trainings, so we have a few more to do. And then we meet also every Monday, Wednesday, and Friday up until May for 30 minutes for questions and answers. So it's definitely, the program is different than what we're using, but I think it's gonna be a better program. We can use our phones, we can use tablets, and we can use laptops in the field. So, that's nice, that'll be nice for us as well. I think that's it.
All right, thank you very much. Any questions or comments, Ms. Ely? All right, thank you. That concludes the reports. Next item on the agenda is board open discussion. Is there anything that any of the board members would like to add to the conversation today? Anything that you'd like to ask questions about or bring up? All right, I guess that's it. Hearing none, we will go ahead and adjourn at 8:34 this morning, the next until the next meeting here at 2C, April 8th, at 7:30 a.m. Thank you.